I'm sort of exiting COVID, if you will, in just a fundamentally different place in who I am professionally, and who I really am as a leader. I'm Tony Clapsis. I work at CVS Health, where I'm the general manager of the Clinical Trial Services business unit. My role, my job, what I do has completely changed. And a large part has been because of the impact that COVID has had, not just on CVS, but really on healthcare as a whole. It's opened up, I think, tremendous opportunities. I had been running strategy for sort of a long time, and I spent 4 months really building our national COVID testing platform. It started as an idea on a page, quickly went to about 1,000 stores within 60 days and 4,000 within 3 or 4 months. We became one of the largest testing providers in the country. I'll be honest, I didn't know much about diagnostic testing or really what it would take to build or scale. And really quickly, it tested, I think, not just knowledge, but leadership and operational abilities that I knew I had, but I really had to step up and really develop that vision and take us through. Being able to kind of identify that opportunity, lay that vision out, build that team, introduce those products, work with sponsors and sort of regulators. It was really end-to-end the building of almost an entirely new business. The challenge that COVID provided to healthcare, it really is what fueled the last year or two of work in really creating these net new capabilities that we're able to expand access to testing. It's really forced me to rethink who I am, as a leader, as a manager, and as an individual, in really trying to build those compelling solutions and the right teams. I'm sort of exiting COVID, if you will, in just a fundamentally different place in who I am professionally, and who I really am as a leader. So I think what's been really interesting is all the rifts and tensions within clinical research that COVID really just exposed. They've been there really a long time. Historically, trials have been organized around large academic centers with professional investigators, not really around patients. And so predictably, costs have gone up, and trials haven't necessarily represented the balance of equity that we'd really like to see. And that's sort of the challenge that I've been really excited to take on. So in September, we quietly launched a new clinical trial services organization, really looking broadly to democratize access to clinical research. It's important for us to have a balance of equities to make sure folks are frankly fairly represented, and that we're actually testing these drugs across different patient populations, which historically I think has been a really significant barrier. I'd say probably 2 qualities. One is resilience. I think we've all seen that and sort of felt that. And I think the professional and personal challenges we've all had managing through that calls to mind having that deep well of resilience, right? To really kind of work through those challenges and towards that broader goal. The second I would say is an enthusiastic kind of optimism we sort of need to have and really remind ourselves of as we're kind of going through those challenging times. And I think folks get incredibly excited as they really galvanize around a mission, and the ability to have a substantial impact against some of the greatest healthcare challenges we've faced. And I think being able to really kind of couple those 2 things together have been important for me and the teams that we've built, but also important culturally, I think, in the organizations we operate in.